DermTech has developed a non-invasive gene expression test to identify lesions at high risk for melanoma. This video will demonstrate how to properly use the adhesive collection kit on a suspicious lesion. The assay has been validated for use on patients over the age of 18 with a lesion size of 5 to 16 millimeters. For larger lesions, multiple collection kits can be used. The test should not be used on lesions located on the palms of the hands, soles of the feet, or mucous membranes. Lesions that are ulcerated or bleeding cannot be tested. To start, remove the contents from the DermTech Adhesive Skin Collection Kit. Each kit contains a gauze pad, an alcohol prep pad, a laboratory requisition form, instructions for use, a black permanent marker, and a sample collector containing 4 adhesive patches in a resealable plastic bag. Remove the trifold sample collector from the sealed bag and fill out the patient information. Carefully review the instructions for use before using this product. Simple instructions for use can also be found on the back of the kit box. Before applying the adhesive patches, cleanse the lesion site with the alcohol prep pad and allow the area to completely dry. You will not need to use the alcohol pad again. If the lesion is in a hairy area, trim the hair prior to applying the patches. Using the gauze pad, dry and rough up the skin at the lesion site. Keep the gauze handy. We will be using it between each adhesive patch application. Open the trifold to expose the 4 adhesive patches. Remove the protective layer that is labeled in red, remove before use. You will place each completed patch there. When ready, remove the first patch. Place the patch on the lesion and use your thumb or the back of the marker to press firmly while making approximately 5 circular motions on the patch. Next, use the provided marker to outline the skin lesion with about a 1 millimeter border. This lesional area will be cut away from the surrounding tape at the DermTech laboratory. Remove the patch from the skin lesion by pulling in one direction and place the patch onto the trifold within the outlined placement areas. Again, use the gauze pad a second time to rough up the skin at the lesion site. Repeat the procedure on the lesion, consecutively applying the second, third, and fourth patches until all 4 patches have been used on the same lesion. Refold the sample collector so that the clear cover is on the outside and confirm that the patient information is noted in the space provided. A unique barcode is located on the adhesive sample collection kit box, the trifold sample collector, and the laboratory requisition form. An additional barcode is included in each box for use on your internal laboratory test requisition, if that is preferred. Place a completed sample collector into the resealable plastic bag and send it in the provided prepaid FedEx envelope along with the laboratory requisition form and the patient insurance information. Multiple samples can be included in each envelope. Contact your Federal Express office or DermTech customer service to schedule a package pickup. Skin samples should be sent the same day as collection and must be received at the DermTech lab within 10 days of collection. Remember to store your kits at room temperature prior to and after use. For any questions on DermTech's Pigmented Lesion Assay or Skin Collection Kit, please call customer service or email sales@dermtech.com.